Hi, my name is Mellisa Ridolfo. This is the Special Populations Simulation Assessment resubmission for me. I'm going to talk about special populations. Clients with specific conditions can gain additional benefits from exercise. Their group of special populations, such as improved functional capacity, improved quality of life, increased independence, decreased mortality, decreased medication and relief of symptoms. However, clients who present with signs and symptoms outside the scope of a fitness instructor, a referral to a medical or an allied health professional is needed. If the client is classified as high and possibly moderate risk, they will need to have medical clearance before participation in fitness testing, programming and the actual exercise. When a client presents with contraindications to the exercise, they too will need to be referred to medical and allied health professionals. The contraindication may be an absolute or relative. Absolute contraindications, the exercise will be stopped immediately. Relative contraindications, the exercise may continue in the absence of triggers or symptoms with a clearance. I will now talk to you about 3 special populations group to explain and modify the session just completed. A client with high blood pressure. High blood pressure or hypertension is classed as a cardiorespiratory condition and is in need of specific exercise requirements. This is a condition where there is a problem with the heart, circulation of blood throughout the body or return of blood to the heart. The blood is pumping at a higher pressure than normal throughout the arteries. This can contribute to a number of diseases including heart attack, kidney failure or stroke. Factors such as obesity, salty diet, smoking, and a lack of physical activity can contribute to hypertension. Standard blood pressure range is considered in the range of 120/80. Stage 1 hypertension ranges up to 160/100. Stage 2 hypertension ranges up to 180/110. If a client presented with high blood pressure and has signs and symptoms outside the scope of a fitness instructor, a referral to a medical or allied health professional would be sought. If a client presented with absolute contraindication, for example, unstable angina attacks, uncontrolled cardiac dysrhythmias or uncontrolled symptomatic heart failure, the exercise would be ceased immediately. If the client presented with a relative contraindication, for example, abnormal heart rate, severe arterial hypertension, or atrioventricular block, the exercise would continue in the absence of triggers or symptoms with a medical or allied professional health clearance. Modifications for the exercises just completed with my client, if they had high blood pressure, I would do the following. A fitness test push-up. I would make sure this would be on the client's knees with a slow and controlled movement. Close supervision kept on client at all times, and keep the intensity low and always making sure the client is comfortable at all times with the correct form. If the form is lost, I would stop the client altogether as they have fatigued. The dumbbell chest press, no change needed as client is lying on back and is supported. Again, close supervision at all times and keeping the intensity low with the reps low and making sure the client is comfortable with the correct form. If the form is being lost, I will stop the client as they have fatigued. An injury could occur. A longer rest period would be given before the next exercise. Single arm row, no change needed here as client is kneeling on the bench for support. Again, a close supervision on the client. Intensity is low and making sure client is comfortable at all times with the correct form. If form is lost, I will stop the client as they have fatigue and make sure no injury will occur. Again, a longer rest period is given before the next exercise. The body weight lunge, again, no change needed as the client is lunging with their own body weight and they have no weights in their hand. But again, keeping a close eye on them. Intensity low, reps low, making sure they're comfortable, and if form's lost, stop the client. A longer rest period before the next exercise. Step-ups. I would make the client use slow and controlled movements here. I would keep the steps lower, not so high. Supervise the client. Watch for the temperature regulation in the client to make sure it is kept regulated. Shorten the duration of the step-ups exercise. And if form's lost, again, stop the client to stop them, they have fatigued and to stop injury occurring. My ground up runs, I would change this exercise to a touch and run on each side, not getting up and down from the ground, as a client with high blood pressure is not suited for an exercise with up and down movements above their head. Close vision kept on the client and making sure they are comfortable, and watching the temperature of this client is regulated, also shortening the exercise so it's not as long. And if the form is lost, again, stop the client, they have fatigued to incur it, just in case that any injury can occur.